positive results for hydroxychloroquine.
The Henry Ford Hospital study that was published was a non-controlled retrospective cohort study that was confounded by a number of issues, including the fact that many of the people who were receiving hydroxychloroquine were also receiving corticosteroids. So that study is a flawed study, and I think anyone who examines it carefully is that it is not a randomized placebo-controlled trial. I don't have any horse in the game one way or the other. I just look at the data.
Dr. Smith, he just looks at the data. Was the study flawed? And what about what Fauci said?
Well, I mean, we know it's not a randomized controlled study. And it was randomized control, but they did control for steroid exposure, and still hydroxychloroquine conferred a benefit. The bigger problem is that Dr. Fauci has taken aim at this study for not being randomized controlled study, where he's endorsed other studies that also were similar observational studies, including the infamous Lancet study, which of course was fraud. And when he cites all these other studies, he doesn't always name them, but they have to be uncontrolled studies. There aren't that many randomized controls. So it's disturbing. There are controlled studies. Even the first virologic study done by the French it had controls. It wasn't randomized, so they were good controls, and that the controls were actually less sick than the drug-receiving patients. The drug-receiving patients cleared virus quicker. Similarly, there's been controlled placebo studies in India. Again, not randomized, but similar controls, and that the healthcare workers that were the controls decided not to take hydroxychloroquine. So these studies are controlled, and on top of it, if I remember correctly, Shelley Wolf, my dad's friend and Dr. Fauci's mentor, and Dr. Fauci, who was my mentor, I appreciate what he did for me. They published their big findings on Wegener's granulomatosis back in the early 70s at an uncontrolled study, looking at the effects of Cytoxan and prednisone, which worked. And I credit them with that. That was uncontrolled.
So
you've got to look at it the same way.
Yeah. So it turns out. Let me jump in here. It turns out, Dr. Oskoui, that Dr. Fauci doesn't believe that these randomized controlled studies are always necessary. But for some reason, they're necessary in the middle of a pandemic where we have hundreds of thousands of people dying, in a situation where people want answers and realistic hope. No one's saying it's panacea or any of that. But what did you make of that testimony today, just specifically on that, and any other thoughts?
Well, unfortunately, I think what Steve has eloquently pointed out is lying by omission is still lying. It's very important to understand that that study did correct for steroid use, but it also pointed out what we seem to see in COVID, which is a steroid paradox, where if you have very mild disease, steroids probably don't help you, whereas if you have more severe disease, as quantified perhaps by a CRP of greater than 20, steroid dexamethasone specifically may be immensely helpful. And what I'm hearing is someone who is frankly very manipulative and dishonest as a scientist.
So the CDC completed an investigation on COVID transmission, or they observed it at a sleepaway camp with children and counselors. And there's some severe limitations in the study, but here's what the CDC concluded. This investigation adds to the body of evidence demonstrating that children of all ages are susceptible to SARS-CoV-2 infection, and contrary to early reports, might play an important role in transmission. Dr. Oskoui, what does that tell you? Should we run from schools and keep our kids locked in the house?
No, I think it means we should believe our lying eyes. We should see that kids simply don't get that sick. We're not seeing wards, ICUs in pediatric hospitals full of sick kids on ventilators. When children do get COVID, or probably more reliably test positive for RNA fragments of COVID, they simply don't get that sick. This buttresses the idea kids need in-person schools, and they need to go 5 days a week, and we need to get the show on the road, just like they're doing in Sweden and a number of other European countries.
Here's an interesting point, Dr. Smith. Nancy Pelosi is often saying that, look, we just need to listen to the scientists. Not scientists who are actually treating patients, but the scientists. But behind the scenes, we found out something different. She reportedly said to Treasury Secretary Steve Mnuchin and White House Chief of Staff Mark Meadows that Dr. Deborah Birx is the worst. Wow, what horrible hands you're in, Pelosi said. So I guess if you don't preen for the cameras and pose for People magazine, Pelosi trashes you. What about that?
Yeah, the whole thing is unbelievable. That, again, Dr. Fauci is right that we have to look at data. That's correct. We have to look at data fairly. And that has not been done. And to demonize people based on their interpretation of the data, that's just unbelievably wrong. I just can't get over this country's response to a drug that is so safe and does work. It's scandalous.
Gentlemen, you've been two voices of reason in a very tumultuous and difficult time, both for science, for the people suffering, for the country as a whole, and we really appreciate you. Thanks so much.